Center Test Prep Exam Final. Question 1. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: Option A, absent breath sounds. Option B, dullness to percussion on the affected side. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. A pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 2. Which finding on end-tidal CO2, ECO2, monitoring indicates successful endotracheal intubation? Option A, ECO2 of 0 mm Hg. Option B, persistent ECO2 waveform with each ventilation. Option C, ECO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ECO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 3. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 4. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotalide. The correct answer is option D, administration of antivenom, crotalide. The definitive treatment for significant pit viper invenomation is antivenom. Outdated first aid measures, ice, incision /suction, tourniquet, can worsen tissue damage. Question 5. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F, hyperkalemia. Option B, hypercalcemia. Option C, hypercalcemia. Option D, hypermagnesemia. The correct answer is option C, hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias. Question 6. The most common cause of lower gastrointestinal bleeding in adults is: Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss tear. The correct answer is option B, diverticulosis. Diverticulosis is the most common cause of lower GI bleeding in adults. Upper GI bleeding is most commonly caused by peptic ulcer disease. Question 7. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 8. A Cole's fracture involves the: Option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. A Cole's fracture is a fracture of the distal radius with dorsal angulation, usually from a fall onto an outstretched hand, foosh. Question 9. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last? as a very late sign. Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 10. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with Option A scalp laceration. Option B, an orbital wall blow-up fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blow-up fracture. Blow-up fractures of the orbit involve the thin bones of the orbital floor or medial wall and often involve entrapment of extraocular muscles or injury to the globe itself. Question 11. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Pyelonephritis is an upper urinary tract infection characterized by systemic symptoms, fever, chills, and CVA tenderness, distinguishing it from lower tract cystitis. Question 12. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid-position and fixed pupils. Option D, constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 13. Hepatitis is primarily transmitted via Option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 14. A high femur involves Option A, retinal detachment. Option B, blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. A high femur is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 15. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 16. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mm Hg and in the left arm is 130/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 17. A female patient of childbearing age with abdominal pain should always be evaluated for Option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 18. A patient with a suspected spinal cord injury develops hypertension and bradycardia. The nurse suspects: Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic activity causing vasodilation, hypotension, and bradycardia. Question 19. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 20. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when 2 or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 21. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. A Sengstaken-Blakemore tube is a balloon tamponade device used to apply direct pressure to bleeding esophageal or gastric varices when other measures fail. It is a temporizing measure until definitive treatment. Question 22. A patient with a spinal cord injury at T1 is bradycardic and hypertensive. This is characteristic of: Option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. The loss of sympathetic innervation in neurogenic shock results in unopposed parasympathetic activity, causing vasodilation, hypotension, and bradycardia. Warm, dry skin below the level of injury is also characteristic. Question 23. Ovarian torsion presents with: Option A, bilateral lower quadrant pain. Option B, sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Ovarian torsion typically presents with acute onset, severe, unilateral lower abdominal or pelvic pain, often accompanied by nausea and vomiting. Question 24. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation, and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 25. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, to apply traction. Option C, cover the wound with a sterile saline moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline moistened dressing and immobilize. In the emergency department, the initial management of an open fracture includes covering the wound with sterile, moist dressings to prevent further contamination and desiccation, and immobilization of the limb.